We all like to believe that everyone gets a fair shot at living a healthy life. But what if that's just not the case? Today, we're going to dig into why some people face a much, much tougher battle to stay healthy, and more importantly, what we can do to start leveling that playing field.
So really, it all boils down to this one question. It seems so simple, but it's incredibly complicated. Does every single person, no matter who they are or where they come from, truly have the same opportunity to be healthy? Well, when you look at the data, the answer is a pretty clear no.
All right, so to really tackle this, we need to be on the same page. Let's get specific about what we mean when we talk about health disparities. Okay, listen to this definition, because the most important word here is preventable. That's the key. These aren't just random, unavoidable facts of life. Health disparities are imbalances that are directly tied to social disadvantages, and that means they are solvable problems. So who is most affected by this? Well, in the healthcare world, you'll hear the term special populations, and it's not about giving anyone special treatment. It's a clinical term to recognize that these groups, from racial minorities to our military veterans to people with disabilities, face a unique set of barriers that require a much more thoughtful approach to their care. So, we've got the what down. Now we have to get into the why. And let me tell you, the reasons are complicated and really woven into the fabric of our society. So let's start to unpack where these inequalities actually come from. And that brings us to this absolutely critical idea, the social determinants of health. See, your health isn't just about your genes or whether you eat your vegetables. It is profoundly shaped by your zip code, by your job, by the air you breathe, and the safety of your neighborhood. These are the real-world conditions that can set you up for a healthy life or for a life of illness. And those social determinants, they create these massive, real-world, systemic barriers. We're talking about things like not having health insurance, or having it but not being able to afford the copay. Or maybe you live in a rural area, and the nearest clinic is an hour's drive away. These aren't personal failures, they're huge obstacles in the system that make even basic checkups feel completely out of reach. And then, on top of all those big system issues, you've got these deeply personal barriers. Just imagine for a second, trying to explain your pain when you and your doctor don't speak the same language, or feeling so scared of being judged or dismissed because of who you are that you just avoid going to the doctor altogether. Bad experiences create fear and break down trust, and trust is literally the foundation of good healthcare. And here's where the rubber meets the road. All those barriers we just talked about, they have a real, measurable impact. Take a look at this. The data shows that nearly half of all African American adults are dealing with chronic health conditions. That's compared to about 35% of Hispanic and Latino adults. These aren't just statistics. These numbers represent real people, real families affected by these gaps in care. Okay, so we've laid out the problem and some of its deep roots, and I know that can feel pretty heavy. But here's the good news. There is a clear, proven path forward. It's all about shifting our focus from just treating a disease to truly, deeply understanding the person we're trying to help. And this, right here, is the absolute heart of it. We have unbelievable medical technology, right? But the most amazing treatments on Earth don't mean a thing if someone can't get to them or if they don't trust the very system that's offering them. The solution has to be human. So what's the big idea? It's something called cultural competence. It's pretty straightforward. It's the ability of healthcare providers to actually meet the unique social, cultural, and even language needs of every single patient. It's about tailoring the care to the individual instead of trying to force every individual into a one-size-fits-all box. And it really breaks down to three core pillars. First is self-awareness. That means providers have to look in the mirror and examine their own biases. Second is respect, not just tolerating differences, but actively honoring them. And finally, avoiding stereotypes, which means seeing every person as a unique individual, not just a label.
Now, all of that sounds great in theory, doesn't it? But what does it actually look like in a busy hospital or a packed clinic? Let's get practical and look at some real tools and techniques that bring this whole idea of cultural competence to life.
Okay, let's take a super common scenario. You might think it's helpful to just ask a patient's son or daughter to translate, right? But that's actually a huge mistake. You risk getting the information wrong, you risk confidentiality, and you put that family member in a really tough spot. The best practice is crystal clear. You have to use a professional interpreter. It ensures everything is accurate, confidential, and safe for the patient. Here's another tool that is so simple, but it is an absolute game changer. It's called the Teach Back method. So instead of asking a patient, "Do you understand?" you say, "To make sure I did a good job explaining, can you tell me in your own words what the plan is?"
You see the difference? It's not a test of the patient's memory. It's a check on how well the provider communicated. It's brilliant.
You know, a patient assessment shouldn't feel like an interrogation. It should be a conversation. And this simple 4-step process shows how to do it with respect. You start by introducing yourself and asking permission. Then you move to open-ended questions. And you always end by summarizing what you heard to make sure you got it right. It turns a checklist into a genuine dialogue.
And honestly, sometimes it's the smallest things that make the biggest difference. A simple, respectful question like this one shows that you're not making any assumptions. It gives the patient control, and it shows that you see them as a person. That's how you start to build back the trust that might have been broken in the past.
All right, let's pull the lens back for a minute and look at the big picture here. Why is chasing after this kind of equitable, culturally competent care so incredibly important?
Because when we get this right, the payoff is huge. It's simple, really. When people feel seen, heard, and respected, they're more likely to engage with their care and follow treatment plans. That leads to better health outcomes for them, way higher satisfaction for everyone, and ultimately a healthier, more just society for every single one of us.
You know, this quote from the source material we're looking at just nails it. It all starts with that internal work, looking at our own biases and making a conscious choice to be respectful. That one shift can completely transform a person's entire experience of healthcare. And that brings us full circle, right back to a question. But it's a different question now. It's not just if we have equitable healthcare, but what would it really take to build it? What does a system where everyone, and I mean everyone, gets a fair shot at a healthy life actually look like to you? That's a question worth thinking about.